Being a cardiologist is extremely rewarding because you take care of people, you save lives, and it's great. But there are some additional perks to the job that you never think of. I have some great patients who really show their appreciation in different ways. One patient owns several racehorses. He named a horse after me. At least he told me he was going to name a horse after me. And it's a 3-year-old now. I don't know much about horse racing, but he mentioned to me, "Hey Doc, your horse Shlofmitz is going to be racing in Kentucky." And I thought he was kidding. And someone got it on the internet, and we're watching the race live. And you see the horse, Shlofmitz, and the announcer actually announced it, Shlofmitz. And so you see him getting in, and the horse won't get into what's called the paddock where they're lining up. And I think mine was a 7 or 8 horses, all the way on the outside. And everyone's quietly sitting there, and this horse, Shlofmitz, they're trying to push him into the thing, and he won't go in.
And they are racing at Turfway, slight stumble.
Finally it goes off, and the horse comes off, and some of my secretaries were betting, my kids were betting, and everyone's jumping up and down, and this horse is dead last. I mean, last. They don't announce it, you don't see it, it's in the back. I thought he was eating daisies, right? And it's a mile run, which is a long run, and the race is going on, and I'm embarrassed. Everyone's like, oh, I had everyone watch this horse race, and dead last. And all of a sudden, towards the end, and I guess in the last quarter of the race, the announcer goes, and on the outside, here comes Shlofmitz. All of a sudden, my eyes perked up.
Second, there goes Shlofmitz, cut loose to the outside, and Shlofmitz is gaining good ground. He's going to have to try to work out a trip here and go to the outside of the loose horse now.
And this horse on the outside, out of nowhere, is coming out like a rocket ship.
And Shlofmitz now puts away Rosada. Now Iggy Biggs will angle off that one's flank.
And ends up winning by 5 or 6 lengths.
And Shlofmitz on cruise control by the furlong grounds, opening up by 5 on the wrong lead, but doesn't matter. With a 16th left to go, Shlofmitz is home and cooled out.
And wins the race after being dead last. And one of my nurse practitioners said to me, it's just like your life, Rich. You started out last, you come from behind, and you win by 5 lengths.
Good morning, St. Francis. We'll start out today with a reflection you'll recognize. Quality is not just chart or standard or specification. It's a state of mind, a commitment.
One of the first things I do in the morning is come upstairs to go to the cath lab and just check the board. Usually I'm alone in the elevator at the time I come in, and I have this brief moment. Poppy was my grandfather and really was, such a role model and influential person in my life. I always find myself looking there and just quietly, thinking of, one, how proud he'd be that, he never got to see me working here. But also, it makes me proud of what I'm doing, and I know, it's always such a good emotional check-in, with myself, and this conversation I still have with him, this 10-second thing. Partly why, I try to always find the positive in things, and it just makes your day better when you see things in that positive light.
My life before the accident was kind of like your standard life. I was 22. I think I was going to college, and I was not sure what I wanted to do, and I was standard, normal. And then the accident happened, and it was like this huge bomb that blew up on me and my entire family and my very close friends. And it's like, it literally changed everything. I woke up a completely different person.
How are you?
I'm well, how you doing?
Good. So, how'd you feel after the procedure?
Good. I mean, it was a little bit of a bumpy recovery in the...
I figured you were going to say that.
Yeah.
Why was that?
I was just laying there, and I was about half an hour from when they were going to have me get up.
Yeah.
And I just was like, ooh, that feels warm, and I was just bleeding.
I heard.
Yeah. So we called them in, and then they were applying pressure.
Right.
And they got it to stop bleeding quickly, but then they put the bag on, just precautionary. Mm-hmm. But then I think they said I had like a vasovagal response to it, because then I started retching. I was like vomiting, and then every time I did that, it would start to bleed again. So they had to keep the pressure to stop the bleeding, but then that was making me nauseous. So then I just had to focus on not, pretend throwing up until I waited for the medicine. And then once I passed that little hiccup, it was fine.
Good.
Yep.
And you've been doing a great job with cardiomams. You've done it every single day.
I certainly have.
Your numbers have been super consistent.
Oh, good.
How have you been feeling? How's the breathing been?
Good. I mean, same thing as always. There are some parts of the day that are trickier, which is interesting because I do the cardio mems in the morning, which is when I usually feel my best.
Yep.
It's usually later in the day when I'm like, oh, I'm feeling, especially if I have been with my feet below me, so I've been, fighting gravity all day. But it hasn't been worse than before or anything like that. So, and it's just good to know that you already know what things look like, so I don't have to be as worried about anything else. Yeah.
Because we would 100% call you if anything is abnormal.
Right, and that's the thing. There are other things that give me symptoms, but heart failure is the scariest one.
Yes.
So from having a sluggish day and then you don't call me, I know it's not that. So it's just, it takes something off my plate, makes me less worried, so it's good. It's an interesting little device. It tells you what to do. Mm-hmm. It's a little forceful, but you can get up now. It's like, okay. But I appreciate instruction. Don't turn off the device. And I'm like, all right, you don't need to go.
I got the message the first time.
But no, it's super easy. But the music is lovely, relaxing. It's like being in the spa.
And it's reassuring to you.
It is.
I mean, that's the most important thing.
It absolutely is.
Lightheadedness, no dizziness, no nausea, vomiting.
I would say that I get the stand-up lightheadedness like once or twice a week. I'll have a day where almost every time I get up, I get that loss of my vision and stuff, but I'm at home, so it's manageable. Yeah.
And it's obviously tolerable for you.
Yeah.
We've had this problem for a long time.
Yeah. It would be different.
Kind of work around it.
Yeah, if I was like at work, it would be a different story, but thankfully I'm not, so I can deal with the medication side effects.
Understandable.
Yeah.
I'm glad everything's working out.
Yeah.
All right, good. You are free to go.
It's nice to see you.
Always nice to see you. Thanks for coming in.
I'm lucky. I'm an aunt to many nieces and nephews because I'm one of 4 girls, and I'm a triplet, and my older sister's only 21 months older, so we're all the same age. My sisters are remarkable, and I think that I'm kind of built to deal with this. My sisters on the other side, they're built to be the sisters of the girl who goes through this, and they have it much harder than me. I would never want to have been in their position the day of my accident. They were handed a pamphlet about how to deal with the death of a young person, and I would rather be on that operating table fighting for my life any day of the week than being told I'm going to lose a sister. So people from Iowa can't be mermaids? You need to stop
Name me a mermaid from Iowa.
Stop crushing dreams.
Name me a mermaid from Iowa.
Stop crushing dreams.
Don't say Ariel, because she was not from Iowa.
You don't know anything about Ariel. We say, like, if somebody had, like, a script of the conversations we have across the house, yelling at each other, they'd be like, oh, I don't know if those 2 people like each other, but we're really just trying to make each other laugh. My husband, I didn't know they made men like him. He's similar to me in that we can laugh at everything, but he also doesn't worry until there's a reason to worry. So he's a good counterpoint for the fact that I'm wildly emotional and dramatic, and he just is a really good, safe space comparatively to the way that my mind can work. So we've been married 10 years. We met about 6 months after the accident, and at the time we thought we were having children. This was not that serious. I got into the car accident, I had my first open heart surgery, and then that was it. Developed really bad arrhythmia, and I ended up having to get an ICD, a defibrillator put in. But then we thought that was it, and we were having children, and but we were like, let's wait a little bit. But then I ended up having a lot of problems with arrhythmia because of all the scar tissue from the heart attack and from the surgeries. So there were like years where I was in the hospital every other month. Our life together is not what we thought it was going to be, but he's never complained. I'm racked with guilt, but he never, because of how he makes me feel. He's a wonderful, wonderful man, and I'm not really sure I deserve him. He's great. I can't be anyone's mom, right? And that's what I would have chosen. I think what I try to do, since I can't leave anything behind in terms of a child, is I try to make sure that when I'm dealing with people, especially in regards to me being a heart patient, which is really how I identify myself, I try to remain positive, and I try to teach other people how to stay positive and to give themselves credit and the right to be upset, but to also kind of harness the strength of making it through a hard day. What I try to give back to trying to fill the hole of what I'm not able to leave behind is just joy and excitement even when it's hard.
You look great.
That's not my inside.
I
I'm
understand.
jumping all over the place.
I understand.
Not only here, it's others on the outside.
Well, I mean, it's par for the course. Unfortunately, it's kind of a whole journey. It's a little bit of a voyage right now for you.
It is.
Yeah.
The big voyage.
I know. And one you didn't sign up for, right?
No, I didn't.
We didn't plan for all the stops.
No, absolutely. I don't know too many people that do, quite honestly, but you know, you look like you're handling it very well right
Just
now.
learning now about the PET scan that I had, you know, what went wrong here and, you know, what I got. I don't know.
Yeah.
2 weeks ago, I had to put a stent in me, that's
Yeah,
all.
I know. Life changes in a minute, you know? People take that for granted sometimes.
Yeah,
So,
just hope that everything goes well, that's all.
well, I think if it's going to, it absolutely will for summer radio.
All right, thank you.
100%.
Think positive.
I do nothing but, couldn't do my job if I didn't.
Yep.
Everyone's rooting for you.
Alright, my name's Karen. I'm one of the nurse practitioners here. I'm going to do your pre-testing.
Very good, Nick.
So come this way. And your birthday?
1/3/1943.
And what surgery are you having done?
Toenails. My heart.
Your heart.
Valve replacement.
Which valve?
The aorta?
Yes. Alright.
Which arm can I use for blood work?
Which one you want?
We'll use a closer one.
Look, you know I've been stuck a lot. Oh my God.
Are you having any shortness of breath?
No.
No. Do you get winded if you go upstairs or walk
You know,
a block or
if,
two?
yes, if I go upstairs, I will get sort of winded a bit,
Okay.
you know.
Any fatigue lately? Do you feel more tired than normal?
I haven't been sleeping lately, so I do feel tired.
The stress.
Oh,
Oh,
ow.
stress. No, okay. Have you had any dizziness or do you feel lightheaded?
No.
No. Have you fainted at all?
No.
No. Do you get any palpitations?
No, not really, no.
Do you have any swelling in your legs recently?
I'm a diabetic and I do have a little neuropathy there, but it's not as bad as it was.
Okay. In both feet?
Both ways, yeah.
And do you have a list of medications with you?
Yes.
Can I take a look? Thank you.
There's no room on the list anymore.
Thank you. We're just going to review your history. So we have down history for you of the diabetes, stents, the heart, high blood pressure. You have a history of sleep apnea.
Yes,
Do you use the CPAP at night or a
No.
mouthpiece?
I
No?
tried it, didn't work.
Didn't work.
No. Machine was faulty.
We have down history of arthritis, spinal stenosis. Says during your knee replacement, you had a low heart rate and your difficulty breathing with anesthesia.
He doesn't remember.
That was a long time
It
ago.
was a reaction to the anesthesia.
Okay. Left rotator cuff repaired twice in
Twice.
2009 and 2014.
Yep.
You've had both knees replaced, the right in 2010 and the left in 2020.
Yep.
And then you've had a shoulder replacement in the left.
Reverse shoulder replacement,
And then an umbilical hernia repair.
right?
And you had cataracts done repaired in both eyes.
Both eyes.
A right knee tendon repair, 2011. Do you have a pacemaker or a defibrillator?
No, I want to get one. I think I'm gonna get one.
Any other medical history that you can think of that we didn't talk about?
Is there anything left?
That's enough, right? We don't need any more? Okay. And so we have down in the computer, both your parents are deceased, and your father had a stroke. What medical history did your mom have?
He's an alcoholic, as he was, you know.
Any history for heart disease, high blood pressure? No.
Don't know. No.
And we ask everybody who comes in if you've ever tried to hurt yourself or has anyone tried to hurt you?
No.
Good. Do you have any?
I'll keep you out of it.
Okay, oh goodness.
Okay, so we're doing a dual chamber pacemaker. Patient had syncope and ended up passing out, smashing their face. So we're putting a pacemaker in. I'm a field clinical specialist and I work in the operating rooms and I'm the cardiologist's eyes and ears for these cases. A doctor will need to implant a pacemaker or a defibrillator into a patient Maybe somebody has complete heart block or their sinus node isn't working appropriately, and we'll come in there with a product, with a lead that goes into the patient's heart, a device that's going to be working for over 10 years to help pace their heart or shock their heart out of a deadly arrhythmia. We're in there during the case, we're handing off the leads, we're handing off the devices. I'm actually testing the leads that are connected to the patient, so I'm pacing the patient's heart to make sure that it's pacing appropriately. And then after that, once the patient has the device for the rest of their life, myself or one of my partners will be at one of the checks to interrogate the device and make sure that it's working appropriately. It's all dealing with the electrical part of the heart. My dad is the plumber, they always say. My dad and my brother are dealing with the plumbing part of the heart, and I deal with the electrical part of the heart. This is them on stand-up paddle boards. They've never been on this ever, and this is the first time ever going on. It's incredible. It's so beautiful. I just love doing new experiences with them. In this field, you're not a doctor, you don't have to go to med school. I specifically went into this field so that I could actually be home more and get to see my kids throughout the day. Some days I work for 12 hours a day, and some days I work for 1 hour a day. I could drop my kids off at school, pick them up, and that was what was really important to me.
Macaroni and cheese.
You had macaroni and cheese? And did you use a fork, a spoon, or a knife?
Fork.
Yeah?
Knife is dangerous.
A knife is dangerous. My dad is the hardest working person in the world, and he did it all for us. He did it for my mom, for my brothers, and myself, but he was never home. My dad would give my mom all the credit, and definitely my mom is probably the reason and the answer to what would keep us all centered and grounded. And my mom is the most amazing person in the world and was always there for us. As a kid, I didn't really like hospitals. I obviously thought it was cool when I was able to watch my dad doing a procedure, and I'd be sitting in the control room and blood everywhere, and it was, what people are watching on TV, and I'm seeing it live. My own, father's actually there saving someone's life. So I understood and appreciated how cool it was. I thought it was the coolest thing ever. When it was bring your father to work day and you say what your dad does, I felt like I had the coolest dad ever. He literally did everything for us. I mean, I think he bought me my first car when I was 12 years old. I couldn't drive then, but I liked the car. He bought the car, we drove it around in our backyard. He ended up giving the car to a nurse a few months later because there was no need for me to have a car, obviously, as a 12-year-old. But anything that could put a smile on my face or my brother's face was what he was doing. So I really knew that even though he might have been absent sometimes, it was for us.
So this is kind of the fun and interesting part of my job is wearing so many hats. So as you know, a lot of cardiologists, their main job is just to see patients. And I love seeing patients. That's still a major part of my job. But I also wear this hat as the Institute director, and that means covering a lot of different aspects. And so what we're doing is headed over from the clinical site, the hospital, over to the research center. I would love to see in my lifetime as a St. Francis employee where the Cardiovascular Institute now actually houses a campus, our new campus. That would be really a dream come true and a possibility, I think, if we have the right support and the townspeople are understanding of how meaningful that really could be. So here we are. This is the St. Francis Hospital DeMatteis Center, the home of the Cardiovascular Institute. There is a little bit of outpatient clinical work here, but not a lot. A lot of diagnostic imaging is here. Our cardiac research MRI is here. We have echo here. The heart failure physicians do some clinic here. One of the things that we're fortunate about is the DeMatteis Foundation actually helps support not only research work, but also procurement of equipment. So that's one of the ways that we can really get state-of-the-art equipment in. So this is one of our MRI systems. We just bought a new 3 Tesla MRI scanner for the outpatient center. And that really allows us to do some really unique things. It's kind of cool. Sometimes in structural intervention, what we'll do is actually use the scans and create a 3D print. And that 3D print helps us to understand things like they're going to be in the operating room in the cath lab. So it's a really nice opportunity for us to turn a 2-dimensional image into a 3-dimensional structure. That is particularly relevant for congenital heart patients where it's all like a big science experiment. Something's connected to something. And it can be hard to really determine the exact geometry and the exact relationship architecturally of the different chambers on a 2D image. So we use the 2D images from the MRI or the CT and we reconstruct them and then create a 3D print. This is the size of a real heart. And this is a print of the human coronary arteries. So this is the right coronary artery here. This is the left anterior descending. This is the circumflex coronary artery. This is how big they really are. You know, when you're in the cath lab and you guys saw these 70-inch Philips screens where the coronary arteries look like Northern Boulevard, that's how big they really are. So that's why a small amount of space makes a huge amount of difference, and why you see us perseverating over a 2.5 millimeter stent versus 2.75 millimeters. If you ever really think that the arteries that supply blood to your heart and let you survive are between 2.5 to 4 millimeters in diameter, it really helps put things in perspective. A little bit of clot, a fleck of clot, will give you a massive heart attack. You know, we're a technology-centered generation. I think we're apt and trained to be able to integrate imaging, physiology, angiography, patient clinical characteristics into one rather than have them piecemeal. So St. Francis is number 24 on the US News and World Report. I think we can be in the top 20 in the next 5 years, and I hope that we're in the top 10 in the next 5 to 10 years. Because we have all the infrastructure, we're making some really great hires, we're growing rapidly, and we're attracting the right personnel and infrastructure. This is Catholic Health, right? We sell hope.
The treatment of aortic stenosis is the single most impactful therapy that we have in cardiology, and I would say cardiac surgery in adults, I think. Yeah. You know, in terms of what treatment means versus not treatment. So patients with severe aortic stenosis and symptoms have, depending on their symptoms, have a 2-year mortality anywhere between 25 and 50%, which is higher than most cancers. And we can offer our patients, in our experience, a treatment. We're putting a new valve in for less than 1% mortality risk and less than 1% stroke risk. So it's, and 80% of them go home the next day. So that's pretty remarkable.
Ed, he was in construction, and it was more than a job. There are some people who go to work to get a paycheck, and some people who go to work because they love what they do. He went to work because he enjoyed doing it, which is important.
Ed, how you doing, sweetheart? I saved a piece for you. Yeah, lady.
He's a volunteer firefighter, just under 50 years. And that's become a huge, huge part of his life. It's like a band of brothers type of thing. And even through all this, he's at the firehouse every day. He's really doesn't do that much firefighting anymore, but they have a huge fish tank. And his job is to feed the fish. And it, like right now, it gives him somewhere to go. I always used to tell people, God will never deal you a hand you can't play, but it's like, we've got nothing but deuces, you know, that we just want to get a few aces thrown our way. Not sleeping, not eating, but like I said, we've been through worse. But things get tougher the older you get. It seems like you don't bounce back as easily. You have to work at it a little harder. But we'll get through it.
Watch your rhythm.
Wow.
You're running there.
So now we have a catheter in the left ventricle, and a catheter CA, where we're going to measure the pressure gradient across the aortic valve. Now we're taking a catheter, a stiff wire, fitting through our catheter that's in the left ventricle. And this stiff wire is going to serve as a rail for us to be able to get the new TAVR.
Watch your rhythm.
Yep.
Thank you.
We check to make sure that the orientation of the valve is proper, that the skirt is on the bottom of the valve, and the outflow or the metal tabs are on the top. The last thing we want to do is put the valve in upside down. Now, this is an Edwards sapien valve, comes on a balloon, and what Dr. Robinson's going to do is pull the balloon back into the valve. It comes loaded so the balloon is up front. It's pulling the balloon back in so that it lines up. I'm advancing the valve like Robinson is holding on the wire, putting some negative tension on it. And bringing the valve right now, you can see it.
Watch your wire coming down.
Yeah. Right.
Rhythm.
Yeah. So now we're pacing at 180 beats per minute. Pacing at 180. We're going to drop our blood pressure to it's 0. The beauty of this procedure and what it means and what we can offer patients. Procedure takes, for us, once we get in the room and the patient's prepped and draped, about 40 minutes.
The treatment of aortic stenosis is truly a miracle in the sense that you can take somebody who is short of breath and who, in most cases, within a year or two, have a 50% chance of either dying, having a stroke, or a heart attack. And you fix it just like that. When we inflated that balloon, that patient did not have aortic stenosis.
Now there's no gradient across the aortic valve. There's 25 millimeter gradient. So at this point, our valve is in. We have to get out of our foot.
Hello?
Hi, Sampson family?
Yes, it is.
Hi.
Carrie Ann Sampson.
Hi, it's Dr. Petrosian and Dr. Robinson. How are you?
Okay.
We're all done. All right? Everything went very well.
Oh, you don't know how good that sounds.
Yeah, I bet.
That's better than the Beatles.
Good.
He's George on Ringo. When can I see him?
Probably within the 2 hours. 2 hours.
Okay, thank you ever so much.
All right.
God bless you.
All right, thank you.
Okay, bye-bye.
Evan and I technically met many years before this at a party in Miami, very briefly, and we became Facebook friends, but we actually didn't connect and meet until Evan was doing his first year cardiology internship at a different hospital, and I was doing my dietetic internship.
Oh my gosh.
It's coming back from the pediatrician. Thought we'd say hello.
How are you?
Show you our hard
Not
jacket.
interested? I love this. How are you?
I don't remember feeling scared. I remember feeling like only in that last 10 minutes, because that was like active labor, where like I'm either gonna die or something's going to happen.
Good. I can't believe she's here. She's never been here. It's her first time in an office.
This is where Daddy goes during the day. She came out in 2 pushes. 10 minutes later, you know, she's out the door. And Evan had to quickly move into action because the water broke very quickly, and she was on her way, and there was nobody around but him, and he grabbed a towel and got right into action.
It's crazy. I remember my first time coming to St. Francis. Crazy.
This little?
I was older than her, but I was 3 years old. I remember they used to have a sky bridge that you used to walk over, and that was so interesting. Connecting two of the old buildings that they got rid of.
Do you want to be a doctor, or do you want to marry a doctor, Sol? He just sat there holding the placenta, kind of half in, half out. I held the baby bare on my chest and over the toilet, by the way, because I thought I was having food poisoning. I didn't know what was happening. I just knew something had to get out of my body. You know, once she was out, it was just 3 of us, and you can't really ask for a more team bonding experience, anything more intimate. There's so much adrenaline involved, and it was super amazing, and I'm so fortunate that it was an easy delivery and no complications actually happened, which of course is something that many people do face, and a reality that should be considered before considering a home birth.
This is Grandpa's office. You recognize your cousins? Oh, yep, you see your cousins. After seeing them the other day, let's see it.
For him, the struggle's probably been the hardest because he really wants to be in 2 places at once. Evan grew up with his dad being a doctor full-time and a dad on the side. I think that Dr. Shlofmitz Sr. is actually much softer than he lets on. I think he's really just as much a dad as he is a doctor, but he definitely, put work 100% first, according to the boys. Evan is, I think, a little bit different because he loves his patients, his work, and his colleagues, but he's really committed to being a dad. I could see his heart break when he misses her first food that she eats or crawl that she takes or all of that. So I think Evan's gonna have a harder time finding the balance of it all. He's super mushy and he's amazing with her, and I think Evan really wants to be part of those everyday moments.
This is where everyone works. This is where I am all the time when I'm not home.
So it's interesting with Ed Sampson. I was talking to his wife, Mary, and when he first presented to me, he was a person who his physician told me had a blockage in his aortic valve, aortic stenosis. And they thought, and I thought, he was coming into the hospital for an angiogram, just as surveillance before he had his valve replaced. But in medicine, you never know what the beginning and the end are going to be. When Ed came in, he had the angiogram and then had severe blockages, and I had to put stents in to prevent a heart attack. And then after that, in the screening for the aortic valve replacement, the TAVR, we found that he had something wrong with his lung, possible lung cancer. As it turns out, after the fact, when he had a PET scan, in fact, he did have lung cancer and needed a resection. So when I was talking to Mary today, I was saying, gee, how's he doing? The surgeon was able to get the cancer. He didn't need chemo or radiation. And all the things he went through were positive because he's on the road to recovery. When little things happen in your life and you deal with what we deal with every day, you say to yourself, you know what, I'm not going to let the little things bother me. The fact that I had a flat tire or that I couldn't get through the motor vehicle, in the realm of things, when you see what we see, you realize how unimportant it is and to appreciate every day you have. Hello everybody. Sorry to interrupt your cocktails. Hopefully dinner will be coming soon. I just wanted to thank everyone for coming to Ohega Castle. And in honor of our guest, Dr. Nicholson. I was lucky enough to be sitting next to him. I don't know how that happened. But we were talking and he was telling me about his history, and it's somewhat parallel to mine, except I was on the other end. His father was an interventional cardiologist, and he always wanted to work with him and did work with him. And I'm lucky enough to have a son who's an interventional cardiologist working with me. So hopefully, Evan, you end up like him, and I end up like his dad. So we're glad to have you here. And the whole purpose of this is for people like him, who are worldwide leaders, to come see what we're about at St. Francis. I have the best of the best here of St. Francis, whether it's surgery, electrophysiology, heart failure, imaging, not so much physiology, structural heart disease, CTO, structural heart, academics. So we have a lot of great people here, and we wanted you to see what we're about and share with you, and you to share with us what you're teaching. So we really appreciate you coming. I know it's a big deal coming up from Atlanta. Anyway, I wanted to thank you. The last 10 years of cardiology have shown tremendous advances. Valves being put in patients' bodies without surgery. Stents using imaging to see precision exactly what you're doing. Heart failure, electrophysiology, advances there as well. And what we enjoy looking forward to at St. Francis in the future is that all our divisions, the electrophysiology division, the heart failure division, structural heart, interventional cardiology, all of us are working together with new technology to bring cardiology to another level. And this is exciting times for patients and for us as physicians. So we've been through a lot, but we're really excited about the next chapter and all the interesting things we're going to be doing in the years to come, and look forward to working with everybody here.